Okay. So I think what has been sort of a common theme in all of our panels over the last few days is this huge elephant in the room, the federal laws around medical cannabis. And so what I want to talk to you guys about is really bring us back to a vision of what that would look like. And again, as you guys know, Americans for Safe Access has been doing work in several other countries. And even though 65 countries have passed medical cannabis laws, you'll see they all come back to, but could you please take care of yours? Because the U.S. prohibition has a huge impact beyond just the individual patients' lives. So let's see if I can get this slide going. Okay. So what we're going to talk about, again, I want you guys to put on, some space in your brain to really imagine a future where cannabis is legal federally. And the model legislation that we have been working on for the last 6 years at Americans for Safe Access would actually do two major things. One, it would create an Office of Medical Cannabis Control, which we'll be calling the OMCC through this. And this is going to be housed in HHS, not in FDA, but in HHS, and it will be a sister organization to FDA. The creation of a new schedule for cannabis, the Schedule 6. And the mission of the Office of Medical Cannabis would be to facilitate access to medical cannabis for therapeutic use and research, regulate the production of medical cannabis products, and oversee this new schedule. And so why is this necessary? And I know we've been talking about this a lot, that some of you may have access to your medical cannabis, but we have to remember the state-by-state compassionate use model is leaving out a lot of patients. It's leaving out people who live in reluctant states, federal employees and contractors. So your postman or woman who delivers your mail every day, they cannot use medical cannabis. And for veterans who are utilizing the VA system, this is not an option for them. And then we also, there's a lot of issues within the medical cannabis states, as you all know. We still do, we're still cleaning up the Compassionate Use Act in California on a regular basis. So we also know that, within this sort of quasi-legal model, insurance coverage is not a possibility. Patients often have to pay for a second doctor, one that's outside of their normal healthcare. And whether a patient is looking at a CBD product or even going to a dispensary, or if they're forced to go to the illicit market, patients are not confident that those products are free of contaminants, that they're accurately labeled or standardized. And I have this weird bar on my thing. Oh, there you go. Sorry. And so we don't even know if, often patients, think that they're getting one thing because they're reading the label and come home with a totally different product. And like I was talking about before, we're still in this space that literally every time a patient goes to a dispensary, it's like we have to start all over again and try different products to try to find one that works for us. Then we find one and we can't find it again. So what would this mean for medical cannabis patients? So this is the part where you're just like, I want you guys to really let this sink in. If we pass a medical cannabis program, this means we would no longer be breaking federal laws to use medicine. And I don't know how much that affects your daily life, but for millions of Americans, that is keeping them from using medicine, or is keeping them from taking the job they want, or some of the other things we've talked about this week. Anyone, no matter what state they live in, can legally use medical cannabis. So your aunt that lives in Iowa, that you just never tell her about medical cannabis because it's not a possibility, will now be a possibility for her. The same protections granted under a prescription for any other medication would be granted to a patient. So that means no longer going state to state to state and begging for protections to be able to drive, to be able to have our children, to be able to have housing. Like, that's all covered because we will have a prescription. There will be an increase in access points. So not only will dispensaries, the current dispensaries that serve us, be able to be specialty pharmacies, but potentially any pharmacy could carry Schedule 6 substances, and we could be able to get medicine delivered to our home just like any other prescription. Federal employees, contractors, they would be able to use medical cannabis. Veterans would be able to use medical cannabis. Patients living in Section 8 housing. Imagine thinking about going on vacation and not worrying about travel restrictions. Imagine, when you're changing jobs, not having to think, oh, are they going to drug test me before I apply for that job? Or maybe you've never been able to apply for a government job, which we all know have the best pensions because they're going to drug test you. Imagine getting a product and knowing that no matter what dispensary you're in, no matter what state you're in, that you can trust the labeling. I mean, imagine that. Imagine, like, no matter where you get this product from a regulated marketplace, that that it has gone through a uniformed product safety check. Imagine your insurance covering your doctor visit. Imagine not having to pay for an ID card separate from a prescription. And imagine us having a pathway that products could be covered by insurance. Like, all of these things are possible if we pass federal law. And so what does this mean right now? So right now, there is no coordination at the federal level for medical cannabis. There's actually, this is just a few logos I could find, but there's actually dozens of agencies that cannabis in some way falls under their purview, but none of them have cannabis experts working at them, right? And so even though, I should just keep going here. Sorry, I was going to go into a little side. But right now, we've been figuring a lot of stuff out at the states. The way that our country was set up was that our states were set up to be laboratories of democracy. Cannabis isn't the only thing that started at the state level. A lot of the environmental protections start at states. The Clean Air Act actually started in California. They had to figure out some bugs before it was adopted federally. And we've really been doing the work on this experiment. We figured out how to regulate it, how to license it. And now we needed to move this experiment into federal policy. So I've shown this slide a couple times. I think it's very moving, but there's now 5 million registered patients in the United States, and all of them, even though they might have access, are dealing with all of the problems that we just mentioned. So right now, in case you don't know, in 2020, Americans for Safe Access actually helped change the scheduling of cannabis at the UN level. And so when we first started Americans for Safe Access, our elected officials told us that that they couldn't change federal laws because they would be in violation of the UN Single Convention on Narcotics. But now the cannabis has been rescheduled at the UN level. The United States is actually out of step with those treaties because the scheduling at the UN, when it's scheduled to show medical benefit, that the contract under the UN single treaty means that countries have an obligation to get a medication to their citizens. So by keeping cannabis in Schedule 1 and keeping it from progressing, we're actually now violating these treaties. So we look at this program, some of the major elements. I mentioned the Office of Medical Cannabis. I mentioned Schedule 6. But there's also going to be coordination with state regulators, right? We're not going to scrap everything that we've been doing for the last 25 years and start over. We're going to take what we've learned and we are going to implement that into this program. So states are still going to be involved. There's not going to be an interruption in current access or in the supply chain. There's actually a huge part of our legislation that actually identifies ways to make sure that your recommendation in your state is going to stay in place until a new prescription guidance is put into place. And then we're going to actually have guidance for all of the federal agencies. Right now, after since we passed the CJS amendment, there's this huge elephant in the room, right? That cannabis is still illegal. So what the CJS amendment is it didn't change federal law. It didn't make cannabis legal. What it did was actually something really weird. It said, okay, cannabis is still illegal, but the Department of Justice and the DEA can't have any money to enforce those laws, which if you think about it, is kind of weird. That's not good policy, right? And again, that was supposed to be triage, in 2014, and here we are. We still haven't moved it forward. But we also have weird things going on, like NIDA right now is putting out RFPs to study the benefits of medical cannabis. That's not in their mission. CDC has $0 to actually look into the populations using cannabis. And literally every federal agency has had to put out some type of guidance to explain how they're not enforcing federal law. So how are we going to do this? So we're going to need Congress and we're going to need the president. And I think what we just showed is that Congress and Senate are willing to pass medical cannabis legislation and that the president's willing to sign them. So we just have to get our proposal in front of people and make sure that they understand that we love research, but we need a little bit more. So the Office of Medical Cannabis, it's, as I mentioned, it puts us back in line with the UN single treaties. It's housed at HHS. The funding is going to come from moving existing funds around, like for NIDA, DEA, DOJ. We're going to actually put that together and figure out where funds should go for cannabis. And then there'll also be licensing and permitting. And it's also going to foster private-public partnerships for research. It is going to coordinate these funds across the agencies and again, coordinate with state regulators. So this is sort of what you see when you look at any agency in DC, sort of where all of the staff is. And I'm going to go into each of these now. So, and a lot of people are really worried about a Schedule 6. So let me explain. Schedule 6 is going to recognize the safety profile of cannabis. It's going to allow distribution, it's going to allow distribution with identity of active ingredients. So this means like, someone who is cultivating with a medical cannabis license in Maine that has a great product, they'll be able, with proper labeling and testing to be able to sell that to a dispensary with a Schedule 6 license in Iowa or in California. There will be no criminal penalties for possession or individual cultivation under Schedule 6. So why this is important is that this will, this will basically create whole new definitions for the schedule. And we had talked about before putting this in Schedule 5A, but there were just too many criminal penalties associated with Schedule 5. And so after talking to many of our allies on Capitol Hill, we decided that Schedule 6 is really a better place for this. And so these are all Schedule 6 is going to be regulated under the Office of Medical Cannabis. So Schedule 6, when we define it, it won't be regulated under the DEA. This is going to be regulated under the Office of Medical Cannabis. And this means, this will get rid of any of those sort of silly things that if you've had a prior drug charge that you wouldn't be able to provide medicine, all of that will go away. And interstate commerce will be allowed. It'll also get rid of any of the issues around banking, around 280E taxation. Cannabis will be legal. So why a new schedule and not reschedule or deschedule? Schedules, look, I would love to see descheduling, but I've been here on Capitol Hill since 2006, and I think we're a far cry from that. But I also, part of living in this country means that we have to find compromise often. And by creating a new schedule, we're sort of bringing all of those things that people who are looking for the descheduling are looking for, but we're also, keeping some type of control that's going to bring on those senators from states that are probably never going to create adult use programs. None of the other schedules work. So the last 3 presidents have said that they would look into rescheduling, and what their offices have come back to them and said is like, none of these work. And so instead of going through that process once again, let's create the new schedule. And I think I mentioned this, that many of the states, they have their own schedule. So when something is rescheduled at the federal level, for a majority of the states, it automatically gets rescheduled at the state level. But there is no policy in place for actually something being descheduled. So the work, if we descheduled at the federal level, we would still have to do the work of descheduling at each state. Okay. So this new program, we have part of it has the Office of State and Local Control. And this is going to make sure that we have a smooth transition. It's going to be up to these states for the states to let the Office of Medical Cannabis know which businesses in their state are medical cannabis licensed. And yes, companies would have to decide if they are going to be adult use or medical. And I think we've all sort of skirted around that issue for long enough, and that it's clear that patients need our own supply chain. So another thing that that the law would do is it's actually going to create guidance for U.S. agencies right away. So the Department of Veteran Affairs is going to be told to implement a policy that allows their physicians to write recommendations and ultimately write prescriptions, that they can engage in research, and that a veteran using medical cannabis would not put them in danger of losing benefits. There would be guidance for HUD right away, telling them to update their protocols so that patients who are in federally subsidized housing would not have to worry about losing that housing. I don't know if you guys know this, but the Office of Personnel and Management is what sets the policies that require every single federal employee for being drug tested. So this would go away immediately. IRS would be told that basically 280E is no longer applicable for medical cannabis businesses and anyone with a Schedule 6 license. The Alcohol, Tobacco, and Firearms Department, ATF, would be told that patients have the right to be a medical cannabis patient and own a gun. Department of Treasury would be told to, basically to treat cannabis like any other business, and to issue a notice to banks that anyone with a Schedule 6 license should be treated like any other business. The Department of Justice would be told to reinstate the Cole memo just so it's clear for those businesses, but they would also be told to expunge all cannabis records and release anyone incarcerated for cannabis. The DEA would be told to adopt new protocols for interacting with state programs under the new Schedule 6 license. And we could use some of that money that DEA would no longer be using, so they can actually help work with the EPA to clean up these disastrous cannabis grows that are on federal lands. And if people don't know about that, basically when the DEA comes across a cannabis grow, they pull up all the cannabis and they just leave this disaster in the national forests. But these agencies are still going to be involved, right? So DEA is still going to enforce issues and products that are outside of the scope of this legislation. Department of Justice, same thing. So they're going to be looking at counterfeit products, products that are people that are faking their Schedule 6 license. And again, because Schedule 6 doesn't have criminal penalties, they will be doing this with civil actions. FDA is going to retain their traditional drug approval process. So if a GW wants to create a prescription drug for cannabis, they can, but it is not a requirement for a prescription for cannabis for a product to go through the FDA process. NIH would actually, instead of just kind of throwing money around for medical cannabis research, they would actually work with OMCC to create a research priority map and distribute funds in a way that's actually going to help everybody working on more evidence-based medicine for cannabis. And NIDA would continue to research harms associated with cannabis use, but really focused on things like THC delta 8 or these sort of new synthetic cannabinoids, rather than trying to put on this hat of studying the medical benefits. There's going to be a reorganization plan. So once this passes, all of these various agencies are going to actually submit a new policy of how they're dealing with medical cannabis. And that is going to reorganize funds that will sort of trickle through appropriations. We have the subdivision of international policy. So this is going to actually have, instead of NIDA being the agency of designation of cannabis under the UN Single Treaty, that will now move to the Office of Medical Cannabis. We're also going to have the subdivision of health and science. And by the way, this presentation is on the ASA website, so don't feel like you have to sort of pull everything in, but I just wanted to give people a view of everything that this includes. So the subdivision of medical cannabis and health and science, they're going to work with NIH on the research priority map. They're going to spearhead guidelines for standardization of testing and labeling. They're going to issue permits for laboratories. So any laboratory will be able to test cannabis. That means people who are home cultivating, they can actually take their cannabis in and get it studied. People who maybe may not trust the place where they bought their cannabis, they can take it to the lab by themselves. And then they're going to create prescription protocols and educate physicians on how to use these prescriptions. The subdivision of medical cannabis cultivation and agriculture is going to work across agencies to create a seed registry, spearhead the creation of pesticide guidance for cannabis for human consumption, train inspectors, and create research and marketing orders, which is something we see with any other agricultural product. Subdivision of state and local control is going to work with states. I already mentioned that, but they're going to work with creating vendor licensing databases. This is something that a lot of state regulators want to see happen, because somebody could be a bad actor in California and then go over to Oklahoma, and there's no way for the regulators in that state to know the history of that applicant. And then I think this is super important. There's going to be a subdivision of patient and civil rights. This is going to review and monitor the implementation to make sure that patient rights are protected. We all know from passing state laws that it's one thing to say, this is what we want this to look like, and it's another thing to make sure that happens. So we're building this into the legislation. And so this is sort of what it will look like after 60 days. Cannabis moves from Schedule 1 to Schedule 6. Federal agencies are notified. Provisional Schedule 6 licenses are awarded to medical cannabis companies, and these are going to remain in effect until 120 days after the OMCC creates new licensing rules, right? So there will be no interruption of access. The Department of Justice will begin its expungement work. HUD will stop discriminatory leasing practices. ATF will remove the language from Form 4473. Department of Treasury will issue guidances for flexibility for banking institution to work with medical cannabis businesses and individuals. 60 days after the enactment, DOJ is going to review and formalize the Cole memo and end prosecutions and investigations, and the president is going to present the reorganizational plan to Congress. 120 days after enactment, IRS exemption for 280E for medical cannabis businesses will be put into place, and within 1 year, each federal DOJ district will complete a comprehensive review and expungement of all adjacent and non-adjacent cannabis cases. And so, I think I've already said this, what's going to happen to the existing medical cannabis programs? So they're going to stay in place. They'll have an opportunity to get a Schedule 6 license, and then ultimately they'll be able to operate like any other business. And for medical professionals, this means that they're actually going to move to a prescription model, something that they're used to, and that they don't have to feel worried about being able to write those prescriptions during the course of a normal doctor's visit. The Office of Medical Cannabis is going to be funded by the reorganization of federal funds, also the licensing fees. So we talked about all the current medical cannabis programs, the cultivators, the manufacturers, the dispensaries, but there's also going to be all the labs, UPS, FedEx, if they want to deliver cannabis, they would be applying for these licenses, every pharmacy. And then we will have an opportunity for private-public partnerships for research. And so what would this mean for patients that are in states without medical cannabis laws? So in the short term, we're still going to be working at the state level to create those programs. But ultimately, if your state does not want to create licensing for cultivation and manufacturing, then your state doesn't have to. But they won't be able to prohibit pharmacies or specialty pharmacies from being able to distribute cannabis to anyone with a prescription for medical cannabis. And that is the fastest presentation I've given on the state law, and we're going to do a Q&A in just 1 minute. On behalf of Americans for Safe Act staff, the board, and all of our members, we want to say a very special thank you to our Unity sponsors for the 2022 Unity Conference. This is our 10th annual conference, and I know many of these sponsors have been with us for the last 10 years. So I want to say a very special thank you to Dr. Bonners, to Metric, to 3C Cannabis Consulting, to Canopy Growth, Tacoma Wellness, the American Herbal Products Association, Cannabis for Cancer Declaration, Cannabis MD, Columbia Care, Council for Federal Cannabis Regulations, Healer, the National Pain Relief, Supply Chain OpEx Consulting, the University of Maryland School of Pharmacy, UKTI Collective, and Evoke. Again, thank you so much. This has been a great conference, and we couldn't have done it without you all.